So prehab is a kind of a new concept. I think we all were focusing on rehab after surgery, but I think what the literature is showing and what we're focusing on now is to strengthen that joint prior to surgery. Patients will have a better outcome quicker. And so prehab is definitely something that will help patients heal faster and accelerate their return to their normal activity. And the X10 is a device that we've used, and I think that's something that's going to help enable patients to get stronger prior to surgery, help them regain motion after surgery.
Well, the first time that I heard about the X10 machine was from Dr. Werner's office. He wanted me to be able to get my legs straight prior to the surgery, which I haven't been able to do for 5 years. So they brought that machine in 2 weeks preoperatively. Inside the first week, I was able to straighten my leg completely, which I didn't think that was going to happen. And it did it without hurting. And I didn't think that would happen either. It's strengthened in a different way than what I was doing with the weights. I have a gym here. I just think it's the fastest, least painful way to get back to full functionality.
My name is Barb Hefner, and I had a total knee replacement. I had the X10 machine before my surgery, and up until now, I had no outpatient therapy or in-home therapy, just the X10 machine. When I talk to people prior that have had this surgery, grown men, that they cried in therapy because it hurts so much. And it's like, well, that's not acceptable to me. The X10, when you're on it, I never cried. I'm challenged sometimes, but just so much more convenient and so much more frequent.
8 years ago, we didn't really do any prehab. When we were talking about surgery this time, he suggested that it might be a good candidate for prehab with the X10 machine to get the muscle strength built up. So we did that for 3 weeks ahead of time of the surgery. But because we've had pain in the knee for so long, you really aren't doing all the things you used to do. So the legs actually atrophied already before you get to surgery, and then it atrophies more. And it really helped after surgery. It's a lot more stable than the other knee was at the same amount of time after surgery.
Hi, my name is Gail. I'm 51 years old, and I just had a total knee replacement on my right knee. I've had no outside physical therapy, in-home physical therapy. When the X10 was delivered exactly a week before my surgery, I used it pre-surgery and exclusively post-surgery, and I love it. I love it. It has helped my recovery. I was at full range of motion at 2.5 weeks. Now I can ride my bike, I can get back to strength training at the gym, I can do my gardening without pain. I was 2 weeks post-op and went to see Dr. Werner, Kelly, his PA. She was incredibly impressed with my progress, by how well my gait and my balance was, and the straightness of my walk at 2 weeks. And the X10 is really the reason that I had that great of a recovery.
Hi, my name is Dianne and I had a revision surgery, and I had it done 3 weeks ago. 2 weeks prior, before surgery, they brought over an X10 machine to me and told me that this is going to help me. I had no home care therapy at all, or no outpatient therapy at all, just the X10 machine. I'm back at 0-130, and it's 3 weeks. The X10 company provided me with a coach. If I needed help, or if I needed to ask any questions, or if I needed a boost, or pick me up, or somebody to talk to, she was there. If I didn't have the X10 machine in my home, and say I had to go out to physical therapy, it would be a problem, considering that the person that I am today, always looking out for others, always doing for other people. I wouldn't make it all the time to my sessions.
Hi, my name is Reba, and I recently had my knee replaced. I had my other knee replaced, and I knew what it was like. And probably what I was most surprised about is having a machine called the X10 in my house. And I felt really good because I had 2 weeks that I could prepare my knee to be strong for surgery. But having the X10, my bend is really good. Before I even went to outpatient therapy, I was going up and down the stairs. I wish I had it with my other knee. I personally think that every surgeon who's going to do a knee replacement should give this to their patient.